What makes the parathyroid hormone so important? Its main job is to keep our blood calcium levels balanced, a vital process for every heartbeat, muscle movement, and nerve signal in the body. In today's episode, we'll explore calcium in a simple, detailed way. What roles does it play in our health? What are the calcium concentrations found in medicines available on the market? How can you choose a reliable and effective supplement? And which blood tests are most important to check calcium or related hormones? Stay tuned. We'll make it all clear and easy to understand. Peace be upon you. I'm Hussein Lotfi, and you're watching the Octopus Pharmacist channel. Welcome to a new episode and continue our series about the human body and its fascinating functions. At the beginning, here are the main topics of today's episode. If you're looking for a specific section, you can choose a video starting with that title. But if you want to understand everything about calcium, from its roles, sources, and supplements, then stay with me until the very end. Calcium is one of the most essential minerals in our body. It exists almost everywhere, but its main storage site is the bones. As we already know, about 99% of all calcium in the body is stored in bones, while only 1% remains in the blood and soft tissues. The total amount of calcium in an adult body is around 1 to 1.3 kilograms. That small fraction in the blood and cells, even though it's minimal, plays extremely important roles in keeping the body working properly. Calcium helps muscles contract naturally and efficiently. It also supports proper blood clotting and helps control blood flow through blood vessels. In addition, calcium regulates the expansion and contraction of those vessels, keeping blood pressure balanced. For the nervous system, calcium is vital. It helps transmit electrical signals, allowing nerves to send and receive messages correctly. Calcium is also necessary for the secretion of hormones and enzymes, which means it plays a role in nearly every process in the body. Because calcium is constantly used and lost, especially through the kidneys and urine, we must replenish it daily through diet. Here's a simple guide. Most adults need between 1,000 to 1,300 milligrams of calcium per day, depending on age and health condition. You can find calcium naturally in many foods: milk, yogurt, cheese, sardines, salmon, and green vegetables like broccoli. Since calcium is widely available, you may wonder, why do some people still need supplements? The answer is simple. Not everyone absorbs calcium efficiently. Some people have digestive issues that reduce absorption. Others have kidney problems that affect calcium levels in the blood. Even low stomach acid or lactose intolerance can make it difficult to get enough calcium from food. In such cases, calcium supplements become essential to make up for the deficiency and prevent bone or muscle problems. So, when a patient cannot get enough calcium naturally, we provide supplements to restore balance, strengthen bones, and support all the vital functions that depend on this crucial mineral. Stay with us in the next part. We'll talk about how to choose the best calcium supplement and the most important lab tests to check your calcium levels and related hormones. Now, let's move to our second topic for today, a very important one. There are many types of calcium supplements available in the market, and patients often ask, what's the difference between them? What are the concentrations? And how can we choose the right product for each person? You'll find calcium available in several forms: carbonate, citrate, gluconate, lactate, and phosphate. But let's focus on the key point. Not all calcium salts are equal. Among them, the two best and most commonly recommended types are calcium carbonate and calcium citrate. So, what's the difference between these two? Calcium carbonate is the most affordable and widely available form of calcium. However, it must be taken after meals because its absorption depends on the presence of stomach acid, and stomach acid levels are highest right after eating. So, if you're using calcium carbonate, make sure to tell the patient to take it right after food to get the best absorption. On the other hand, calcium citrate is more expensive, roughly twice the price of carbonate. But it has an advantage. It does not depend on stomach acid for absorption. That means it can be taken before or after meals with or without food, and it will still be absorbed efficiently. This difference becomes especially important when dealing with older adults. After the age of 50, many people produce less stomach acid, a natural part of aging. In those cases, calcium carbonate becomes less effective, while calcium citrate remains well absorbed. So, for patients over 50, always prefer calcium citrate because it works better regardless of stomach acidity. Now, let's move to the second key point, the dosage. No matter which type of calcium you choose, it should never be taken in a single dose higher than 500 milligrams at one time. If you take more than that, the body cannot absorb it properly, and the rest will go to waste. So, if the doctor recommends 1,500 milligrams per day, this dose should be divided into 3 separate doses throughout the day. This ensures the body can absorb and use calcium efficiently. The third point is extremely important and often confusing. When we talk about daily calcium needs, such as 1,000 to 1,300 milligrams per day, we're referring to pure calcium, also called elemental calcium, not the total weight of the compound. What does that mean? Let's take calcium carbonate as an example. If you have 1 gram, 1,000 milligrams of calcium carbonate, it actually contains only 40% pure calcium. So, 1 gram of calcium carbonate provides about 400 milligrams of elemental calcium. Let's do a simple example. If a supplement says it contains 800 milligrams of calcium carbonate, then 40% of that is pure calcium. So, 800 milligrams times 40% equals 320 milligrams of elemental calcium. That means you'd need to take 3 to 4 tablets per day to reach the recommended total of 1,000 to 1,300 milligrams of pure calcium daily. Here's how other forms compare. Calcium citrate contains 21% pure calcium. Calcium lactate provides about 13%. Calcium gluconate gives only 9%. This is why carbonate and citrate are considered the best and most practical options. They provide the highest concentrations of elemental calcium, meaning you can achieve your daily requirement with fewer tablets or doses. So, to summarize, 1. Choose the right type, carbonate for younger adults, citrate for those over 50 or with low stomach acid. 2. Split the doses. Never take more than 500 milligrams at once. 3. Check the label carefully. Always look for how much elemental calcium the product contains, not just the total compound weight. By understanding these simple principles, you'll be able to select the right calcium product for each patient, ensuring better absorption, fewer side effects, and stronger bone for life. Now, let's move to the fourth important point when using calcium, the common problems that can appear during its use. In most cases, people may experience a dry throat, gas, or constipation. That's why we always advise anyone taking calcium tablets to drink plenty of water with each dose. Calcium can slow down bowel movement, which may lead to constipation. Drinking enough water helps prevent that, and it also prevents the tablets from sticking to the throat or causing irritation while swallowing. These 2 points are very important, and they're part of your pharmacist counseling role. You must always warn and educate the patient about how to take calcium safely and comfortably. Now, the 5th point, and it's a very important one, is about drug interactions. Calcium can interact with many other medications, which may reduce how well either one works. To avoid this problem, always advise patients to separate calcium from any other medicine by at least 2 hours, either before or after taking it. This simple step prevents most of the common interactions. Let's go through a few examples. First, antibiotics like ciprofloxacin and tetracyclines can interact with calcium, forming complexes that make the antibiotic less effective. So, they should never be taken together. Next, bisphosphonates, which are drugs used to treat osteoporosis and bone weakness, also interact with calcium. They should be taken at different times of the day, not together. Levothyroxine, the hormone used for thyroid problems, also interact with calcium, so keep a 2-hour gap here as well. Now, when it comes to diuretics, water pills, the effect depends on the type. Thiazide diuretics, like hydrochlorothiazide, can increase calcium levels in the blood by reducing its loss through the kidneys. Meanwhile, loop diuretics such as furosemide, Lasix, do the opposite. They increase calcium loss, lowering its concentration in the blood. Also, antacids that contain aluminum or magnesium and corticosteroids like prednisone can both increase calcium loss from the body. That's why one of the known long-term side effects of corticosteroids is osteoporosis or bone thinning, not constipation as many people think. So, always remember these two golden rules. 1. Drink plenty of water when taking calcium to prevent throat irritation and constipation. 2. Keep at least a 2-hour gap between calcium and any other medication to ensure safe and effective absorption for both. Now, let's move on to the third and final topic in today's episode, the laboratory test that we need to focus on when dealing with calcium. The first and most important test is the parathyroid hormone, or PTH for short. Whenever there's any concern related to calcium levels, such as abnormal blood calcium, kidney issues, or bone problems like osteoporosis, doctors always check the level of PTH. This hormone plays a key role in regulating calcium and phosphorus balance in the body. The normal range of PTH in the blood is between 14 to 65 picograms per milliliter, and it's usually measured after fasting for accurate results. The second factor that affects calcium levels is phosphorus. Its normal range in the blood is 2.4 to 4.1 milligrams per deciliter. Now, how does phosphorus influence calcium? When the level of phosphorus in the blood increases, it signals the kidneys to activate vitamin D. Once vitamin D becomes active, it works in the intestines to enhance calcium absorption, which raises the level of calcium in the blood. So, when phosphorus goes up, calcium levels may also rise indirectly through the action of vitamin D. The third important element is, of course, vitamin D itself. If vitamin D levels in the blood are below 30, it's considered deficient. Between 30 and 50, it's insufficient. From 50 to 70, it's adequate, and above 70 is excellent. Vitamin D is crucial because it helps absorb calcium from the intestines and directs it to bones, improving bone density and strength. That's why most calcium supplements you'll find on the market include vitamin D. The two always work hand in hand. If vitamin D levels are too low, calcium absorption decreases, which can lead to muscle cramps, bone pain, or weakness. We've already discussed vitamin D in detail in a previous episode. I'll leave a link to it in the description below. The fourth important test is the calcitonin test. We talked about calcitonin earlier, and we know that its function is opposite to that of the parathyroid hormone. While PTH increases blood calcium, calcitonin lowers it by storing more calcium in the bones. But here's something important. When we assess calcium balance, we don't usually need to test calcitonin levels. So, what's the real purpose of the calcitonin test? It's mainly used to monitor certain thyroid conditions, not calcium disorders. If calcitonin levels are abnormally high, for example, 20 times above the normal range, it could indicate C-cell hyperplasia or a type of thyroid cancer known as medullary thyroid carcinoma. The normal level of calcitonin is usually less than 100 picograms per milliliter. So, when doctors find very high levels, it becomes a diagnostic marker for those specific conditions. Now, this brings us to a common question. If a patient undergoes thyroid surgery and the gland is removed, do they need to replace calcitonin afterward, the same way we replace thyroid hormones like thyroxine? The answer is no, we don't replace calcitonin. That's because the body can naturally adapt to its absence, and other regulatory mechanisms help maintain calcium balance without needing external calcitonin. So, in these cases, calcitonin is mainly used as a biomarker to check whether thyroid tissue has regrown or cancer has returned, rather than for calcium management. The fifth and final analysis we focus on is the calcium level in the blood itself. The normal total calcium concentration is between 8.5 and 10 milligrams per deciliter, which equals 2.2 to 2.7 millimoles per liter. This number represents total calcium that includes both free, ionized calcium and protein-bound calcium. In the blood, About half of calcium is ionized or free, and the other half is bound albumin, a protein made by the liver. The free calcium, which is the active form, normally ranges between 4.4 and 5.2 milligrams per deciliter. However, in most cases, laboratories only measure total calcium because it's faster and easier. Testing free calcium is usually reserved for special conditions, such as liver disease, where albumin levels are affected. Here's why this matters. If the liver isn't making enough albumin, less calcium binds to it. So the free calcium may rise even though the total calcium seems normal. This can make lab results confusing. To correct that, doctors use an equation called corrected calcium. It helps calculate the true calcium level in the blood based on the amount of albumin. The formula is corrected calcium equals measured calcium plus 0.8 times for serum albumin. This equation is very important, especially for patients with liver disease, malnutrition, or kidney disorders, to ensure calcium results are interpreted correctly. In summary, when evaluating calcium, always think of these 5 key tests. 1. Parathyroid hormone, PTH, controls calcium and phosphorus balance. 2. Phosphorus works closely with calcium and vitamin D. 3. Vitamin D, essential for calcium absorption and bone health. 4. Calcitonin, mainly a marker for thyroid conditions, not for calcium regulation. 5. Calcium levels, total and corrected, the main indicator of calcium status in the body. And that's the end of today's episode. I hope this video gave you useful, practical, and scientific insights into calcium and its related tests. Don't forget to like, share, and subscribe to the channel. And if you'd like to support our educational work, you can do so on Patreon, PayPal, or directly here on YouTube. Thank you for watching, and as always, stay healthy, stay curious, and good night.